Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. I've been performing plastic surgery in the Scottsdale Paradise Valley area since 1992, and all I do is cosmetic or aesthetic plastic surgery. I perform a lot of rhinoplasties, and I'm very proud that I have a very low personal revision rate. I see a lot of consultations for people that are unhappy with rhinoplasties, unfortunately, from other surgeons, and want me to render an opinion and want to know is a secondary rhinoplasty or revision rhinoplasty more difficult than a primary rhinoplasty, and why? Um, I think the two most common reasons, with regards to having a revision is that, possibly something didn't go well during the procedure, and possibly follow-up was not great, or there was a lack of communication. A revision rhinoplasty is more difficult than a primary rhinoplasty for a couple reasons. One is that although I can get an operative report to read what the original surgeon did, I was not there, so I'm not completely 100% sure until I do the procedure what actually I'm going to see when I get in there. The second thing is that, like any tissue, a rhinoplasty heals by scar tissue, and that's how we heal, and that's how things stabilize. The problem is that a lot of the structures that I want to revise and remove or add to are surrounded by scar tissue, and that makes the operation a bit more difficult. I really enjoy doing revision rhinoplasties, and quite often a lot of those revisions will require the addition of more cartilage that is usually taken from the septum of the nose or possibly behind the ear. These cases, or your case, is quite challenging. I find it very satisfying. But the last part is that because of the scar tissue and because of the different things that I may need to have to do to manipulate the nose to make it look better, there's prolonged swelling, and you can bank on that. And I think that people get quite frustrated with that. And oftentimes it takes a year or two to see the final result. I see my rhinoplasty patients quite often after my surgery is performed, and why I do that is that quite often I will put very dilute steroid into the tip of the nose or above the tip to help decrease some of that swelling. I have the luxury of seeing what your nose will look like in the operating room, but that changes immediately because there's swelling there. So that swelling gradually goes down, and there are certain things that I can do to help that swelling move along, that being steroid injections and having you go ahead and learn how to massage your nose. But overall, I think that secondary rhinoplasties are more difficult than primary rhinoplasties. They're personally very rewarding for me, and they're some of the happiest patients that I have. But the best way to understand about whether you're a candidate to have your nose revised is to come in and get a consultation. I like to see your before photos before you've ever had your nose done. I like to see them after you had your nose done. And we go through a plan, and we figure out what a common objective, both aesthetically and in terms of functionally, is the best thing for you. Thank you.